And now I'd like to welcome Dr. Larry Levin, who is board certified in orthopedic surgery. He completed his orthopedic residency at the Medical College of Virginia and his fellowship in sports medicine at Ohio State University. He is an associate clinical professor at the University of Miami School of Medicine in the Department of Orthopedics and Rehab, and he is an affiliate clinical assistant professor in the Department of Biomedical Science in the Charles E. Schmidt College of Science at Florida Atlantic University. Dr. Levin is in private practice at Boca Raton Orthopaedic Group in Delray Beach and has been the chair of the Department of Orthopedic Surgery at Boca Raton Community Hospital since 2005. And also with us tonight we have Rob Signorillo, who is the rehabilitation supervisor at the Davis Therapy Centers at Boca Raton Community Hospital, where he has been a physical therapist for 14 years and supervisor for 4 years. Rob has worked with Dr. Levin for the past 8 years at FAU as the athletic department's team physical therapist, with the most emphasis on returning athletes back to the field after surgery or major injury. Now, we'd like to welcome Dr. Levin.
Well, thank you very much, and welcome, everybody. We're just going to review a few things tonight, and the goal really is going to be to try to keep you out of our office. It's sort of a new twist on medical presentations these days, it seems, because it seems so oftentimes someone's just trying to tell you about a new procedure they can do for you. But we're going to try to review some things to try to keep you away from us. And first things that we're going to do is I'm just going to try to review just what some basic definitions are, because there's a lot of confusion out there as to what a bursitis is, what a sprain is, what a strain is. And so often I have people coming in and they'll basically tell me what's wrong with them, and I'll go, well, what does that mean? And it just becomes sort of this lump-all term for a pain in a certain region of the body. So we'll just go through a few things. So again, as we talked about, we'll talk about the definitions. We'll describe a little bit as far as how they occur and how the signs and symptoms are. A lot of these things you already know, because if you're like me, I've experienced about all of the things I'll be talking about. So as I tell everybody, try to do as I say and not as I do, because I've definitely done a good job of hurting myself over the years. We'll also talk about treatment, some prevention, and then we'll be turning some things over to Rob and the guys here, and they'll be going through things in even more detail with you as far as some do's and don'ts, as well as how to do them properly. So things we'll go through here briefly are going to be definitions of what a strain is, what sprains are, what a tendonitis is, and what bursitis is. So first of all, what is a strain? Well, generally this is going to apply to muscle. And when you think about how a muscle is constructed and just how everything flows, just think about, for example, your biceps muscle. You see the bodybuilders, they got a big biceps. Well, that big stuff there, that's the muscle. Or in other folks, that's where that little stuff is the muscle. Now, what a tendon is, the tendon then connects the muscle, and then it connects down into the bone. Okay, so the muscle becomes a tendon as it blends in microscopically, and then macroscopically, and it actually attaches to the bone. So now, what happens in a strain is you can basically think about it as where those muscle fibers, as they're sitting here together, they fail and they sort of slide past each other in a way. And there can be different degrees to that. And again, if anybody has ever tried to sort of leg it out to first base and suddenly you're grabbing back there, that's what a hamstring strain is. So some of the different causes, so oftentimes in sports it's usually a sudden movement. It's that sudden contraction of the muscle against that force, and these things pull. Sometimes trying to lift something too heavy. Just some obvious things that, again, most of us have probably experienced. What sort of things are you going to feel? Again, a lot of these things, you just know it right away. You know, some people describe they feel like there's a pop. There'll be pain, tenderness, some swelling, and problems trying to just move that muscle. Now, as far as a sprain, again, the difference of a strain versus a sprain. So, first of all, when we sprain something, it applies to the ligament. And what ligaments are, you can think about them like ropes that kind of hold the joint together. Okay? So in the knee, things that people hear about, one of the famous ligaments is the anterior cruciate ligament. And it sort of depends on which athlete has damaged it that year as to whose name is stuck on it. And as far as these types of things, there are different degrees of those types of injuries as well. And as physicians, we even grade these like into a first, second, and third degree sprains. And those types of things will be where, again, where these fibers can either fail a little bit, they fail partially, or they're actually torn completely in half, which would be a grade 3 sprain. So different causes for these types of problems. Again, in sports, sudden turn or twist, fall, people are hit. Again, symptoms can include pain, swelling, bruising, and problems trying to use the joint. And depending on what joint, can be problems with instability. So we'll then go to the next tissue, which is a tendon, and this is going to be for tendonitis. Again, we just sort of talked about that transition of muscle to tendon, and one of the areas that people think about so much is tennis elbow. Well, that's right where the tendon attaches here to the bone. And again, a similar sort of thing. It's where you start getting failure of those fibers, and there can be different degrees of that. So usually it's most commonly caused with repetition overloads, for example, tennis players, as they're either racket problems or form problems. And what happens is that tendon, where it's injured, just sets up this rip-roaring inflammatory response and gives you pain. And the last thing, one of the next things or last things will be bursitis. So again, one of those things that becomes this sort of lump ball term, and most commonly people will think about it, and they think about it being their shoulder. Doctor, I got the